This is the Educare module on mobility, with emphasis on lifting and safe transfers. My name is Nicole Rennie. I'm a physical therapist and geriatric certified specialist in physical therapy. I've been a physical therapist for over 20 years. One of my favorite things to do is educate caregivers on how to transfer someone more effectively and efficiently using this 4-step process.
I'm Jean Howell and will be the co-facilitator for this module. I have more than 35 years' experience as an RN working in assisted living, home care, and clinics.
We're really going to learn about transfers today and understand the factors that contribute to a safe transfer. You're going to learn the 4 stages of a transfer, and this technique can be used with every client, with every diagnosis, and every age. You're going to find out key phrases to use to improve the quality of a transfer. You're going to understand why a walker is beneficial to use during a transfer, rather than having the client rely on you for support. And lastly, we're going to focus on caregiver safety tips. There are 3 parts to a transfer. There's the environment, which means the chair or object that the client is sitting on, the caregiver technique, and the client leg strength. All of these components contribute to a transfer going smoothly or not. Before even starting the transfer, check the environment. The object or chair that the client is sitting on is extremely important. The chair should allow the client's hips to be slightly higher than their knees. If the hips are below the client's knees, the client will need more leg strength to get up from the chair. What this means is caregivers, you will have to lift more. Remember, it's just not the chair that the client is sitting in that needs to be assessed. Look at the couches, the toilets, and shower chairs. All of them should be adjusted to the same height that maximizes the independence of the client. Remember, their hips should be 1 to 2 inches higher than their knees. It's also essential that the chairs have full-length arms. This will help the client push themselves to standing. The second part is the caregiver technique. We are going to learn this in depth today. If the client's environment is appropriate, and the caregiver is using proper technique, and the client has good leg strength, the client will be able to transfer independently. If the client has poor leg strength, it is more essential that the environment and the caregiver technique is appropriate. By modifying the first 2 parts, the amount of work that the caregiver needs to do will be reduced. Let's examine 2 different types of chairs that you might see. The chair on the left is a good chair because the hips of the clients are slightly higher than their knees, and the back of the chair is upright and sturdy. The chair on the right, the client's hips are actually lower than their knees. The back of the chair is angled backwards, causing the client to slouch. Make sure you can see the difference between the 2 chairs. Let's talk about some basics with transfers. A client should wear shoes at all times. Shoes stop the clients from slipping, and they give them more stability, especially in their ankles. Ensure that the brakes of the wheelchair are locked. Locking the brakes will stop the chair from sliding backwards and will prevent injury to both you and the client. One of the tricks to being a physical therapist to make our transfers easy is that we speak slow and in short phrases. This gives the clients confidence and they can understand our directions. Phrases like stand up, turn, sit down, and then the simple word of stop if the client is becoming unsafe. Another common phrase that is used by physical therapists is if you start, I'll help you if and when you need it. Give the clients time to initiate a task before helping them. The more you help them, the more quickly they will become weaker and they will need more assistance. Clients trust the stability of a walker more than the support of a caregiver. Therefore, if a client uses a walker when walking, use the walker when transferring. Let the walker support the client's weight, not you. Using the walker reduces injuries for both the caregivers and the client. You may be surprised at how much more comfortable the client is in standing when the walker is placed in front of them. I have seen clients that if I stand in front of them to do a transfer, they need total assistance to go from sitting to standing. But if I place a walker in front of them and give them the proper cues, they can stand independently. Also, using a walker allows the caregivers to have one hand free to help as needed. Always have the client push from the wheelchair arms, the chair arms, or the bed. Do not let them pull on the walker, table, or sink to stand unless directed by a physical therapist. It is much easier for most clients to push rather than to pull onto objects. Also, Also, oftentimes there are not objects for a client to pull up on, therefore the caregiver will need to do more work. This is a representation of a client who walks with a walker and the position the walker should be in during a transfer. This is a representation of what happens when a client pulls on a walker to stand. It places both the client and the caregiver at risk of injury. Even if the caregiver is holding down on the walker, both could get injured. Please have the client push from the arms of the chair to stand. There are 4 stages of a proper transfer. There are scoot forward, feet back, lean forward, push. The aim is to get the client into what I call the launch position. This launch position maximizes the client's independence and, if they have memory issues, cues them into what the next step should be. Here are the basics of this 4-stage transfer. It is a stage-to-stage process, and it needs to be completed in the order discussed. The client nor the caregiver should proceed to the next stage until the previous stage is completed and maintained. If the client moves back to an incorrect position, the caregiver should go back and correct it prior to moving on to the next stage. If the client is not able to get themselves into the correct position, the caregiver should assist. Also, let the client start the motion, and then, if they need help, the caregiver can correct the position. This 4-stage transfer is valuable for all diagnoses and all ages. The first stage is scoot forward. Scoot forward is the phrase that you use with the client. The perfect position is when the client is scooted all the way forward to the edge of the chair. Most people do not scoot far enough forward. Most clients do not slide far enough forward. Either the caregiver or the client is afraid they're going to slide off the chair. There are 2 ways to scoot forward. The client can just easily slide their buttocks side to side until they're sitting at the edge of the chair. If the client does not have enough strength, have the client lean backwards and push their shoulders against the chair and scoot their buttocks forward. Caregivers, if you need to assist them, I have them do the second technique. You have their hands on their butt and you help scoot them forward. Please always remember to tell them what you're going to do prior to moving them. This is a representation of the correct scooting forward position. Notice how far forward the client is sitting in the chair. Let's examine correct scoot forward position and incorrect. The photo on the left again is the correct position. Notice how far forward the person is sitting in the chair. The photo on the right, the person is not scooted as far forward. This will make the transfer more difficult. This means that the client will need more assistance to stand. Please reassure the client that scooting forward all the way to the edge of the chair is safe for them and will maintain their independence longer. The second stage is feet back. Feet back is the direction given to the client. The perfect position is when the client's feet are back underneath them and their heels are slightly off the floor. If the feet are not far enough back, the client will not get enough feedback from their legs to know what the next step is. Putting the ankles on stretch will help the muscles initiate and make the client more independent. Please reinforce that the knees are bent and the ankles are slightly off the floor. This is a photo that represents the correct feet back position. Again, notice that the knees are bent and the heels are slightly off the floor. Here is a representation of correct and incorrect feet position. Again, the correct position is on the left. Notice how the heels are slightly off the floor. In the photo on the right, the knees are not bent as far and the ankles are not off the floor. People will be required to have more leg strength if their feet are not bent back and their ankles are off the floor. Assisting someone with bending their knees back and having their ankles off the floor can be the difference between lifting someone from a chair and not. This ankle position is crucial for those with memory loss. It gives them the feedback they need to know what task you're asking of them. The next stage is lean forward, and lean forward is the direction given to the client. The perfect position is when the client's nose is past their knees. Notice this is different than what has been said in the past. In the past, the phrase has been nose past your toes. When the feet are bent back to the proper position, the phrase nose past your toes does not allow enough lean forward for the client to get up independently. That is why the new direction, or the perfect position, is when the client's nose is past their knees. Typically, clients don't lean forward enough. Many clients are fearful of falling forward. Placing a hand on the client's back and holding them forward until they relax is the key to getting them into the perfect lean forward position. This photo is a representation of the correct lean forward position. Please note that the client's nose is past their knees. This is a photo that compares the correct lean forward versus the incorrect lean forward. The correct position again is on the left-hand side. The incorrect is on the right. Please notice the photo on the right is the typical position in which caregivers place older adults to help them stand. This is not enough bend at the trunk to have the client be independent with their transfers. What this means for caregivers is that you will have to do more lifting. Please encourage the client to lean more forward by placing your hand on the middle of their back until their nose is past their knees. Following these 4 stages, the client is now in the launch position. If the client has memory issues, this position directs them to what you want to do. This launch position also maximizes the client's ability to complete as much of the sit-to-stand process on their own. Their only limitation would be the amount of leg strength they have. If the person has good leg strength, you've placed them in the proper position, and the chair is at the correct height, the client will be independent with their sit-to-stand transfer. This photo is a representation of the perfect launch position. Notice that the client is scooted forward, their feet are back, they're leaned forward, and their hands are on the side of the chair. In preparation for the final stage of push, where should the caregiver stand? Remember, if the client walks with the walker, they should be using the walker for a transfer. Therefore, the caregiver should stand at the side of the client. With this position, the caregiver has one hand on the transfer belt, and the second hand is free as needed. I've been a physical therapist for over 20 years, and I rarely stand in front of a client to transfer them. Remember, the clients trust the stability of the walker over us as their stability. Even if it is a 2-person transfer, one caregiver is on the left side and the other caregiver is on the right. Each of them has one hand on the transfer belt and the walker is in front of the client. Even if a walker is not used, the transfer is completed the most safely when one caregiver is on each side. The final stage is push, and push is the direction given to the client. Ask the client to push from the arms of the chair. Be patient and let the client initiate this movement. Do not lift them immediately out of the chair. I always recommend that you wait 5 seconds before lifting them. If the client does not move, I often use the phrase, "You start and I'll help you when you need it." This gives the client reassurance that you're there to support them if needed. You also may need to remind them to push several times before they start the motion. Most people have enough strength to start the motion and need assistance at the end of the standing process. So please be patient. The more they do for themselves, the longer they'll be able to complete their transfers with the least amount of assistance. This photo is a representation of the push position. Notice the client is pushing from the arms of the chair and not pulling on the walker. I want to discuss briefly how to use a transfer belt. The transfer belt should be tight around the client's waist. Remember to inform the client that you're going to tighten the belt and remind them it's going to be a little bit snug. Also, when they stand up, the belt will loosen. The caregiver's hand should come up from the bottom of the transfer belt with the palm facing away from the client. This allows the caregiver to have the most support and most strength in their arm to help keep the client safe.
Let's review the procedure to transfer a person from sitting to standing. 1. Caregiver examined the height of the chair. 2. Client wore shoes. 3. Caregiver made sure brakes were locked. 4. Client used a walker for safe transfer if they use one when walking. 5. Client did not pull up on walker to stand unless approved by physical therapy. 6. Client was in correct scoot forward position, buttocks at the edge of the chair. 7. Client was in correct feet back position, heels off the ground. 8. Client was in correct lean forward position, client's nose past their knees. 9. Client was in correct launch position. 10. Caregiver allowed client to push from armrests prior to lifting. 11. Caregiver gave client time to initiate individual stages prior to assisting them. 12. Caregiver spoke in short, slow phrases. Number 13. Caregivers did not proceed to the next stage until previous stage was completed and maintained. And number 14, used correct method with transfer belt.
Okay, I'm going to lock your brakes. I need to put your transfer belt on.
Oh, yeah.
It's going to be a little snug. So, Leona, we're going to stand up together. So, scoot your butt forward in the chair. So, it's all the way to the edge. Good. Now, pull your feet back so your heels are off the floor. Lean way forward. Lean a little bit more. More. You won't fall. Keep going and push. Good job. And stand up nice and tall. Caregivers, your job is not to lift clients. Your job is to help assist them in being as independent as they possibly can. We want you to be safe. We do not want you lifting, and that is why we've gone through these 4 stages. So how much lifting should you actually do? The simple answer is as little as possible. Caregivers should not power lift the client out of the chair. Let the clients initiate standing prior to assisting them. Most clients can begin to stand, but they may need help finishing the movement. Remember, as discussed earlier, if the client does not move, start the process of standing again. State, "You start, and I will help you when you need it." Sometimes the clients just need a little bit of encouragement and reminding them that they are safe and that they can do this on their own, and that you are there to support them. Here are things that are not recommended when helping someone stand. It is not recommended that the caregivers support the clients under their arms. This can cause severe injury to a person's shoulders. The client should not place their arms around the caregiver's neck. If the client gets scared, this could cause them to choke the caregiver. The client should also not place their arms around the caregiver's waist. Again, if the client gets scared, the client could injure the caregiver's back. The caregiver should not hold the client's hands and pull them to a standing position. In this position, the caregiver has no support and no way of saving the client if the client starts to lose their balance. Also, older adults' wrist joints are very weak, and pulling on their wrists could cause injury. Finally, do not let the client pull on the walker, table, or sink unless directed by a physical therapist to stand.
Let's review the procedure to move a client from a chair to a bed. 1. Caregiver examined height of the chair. 2. Client wore shoes. 3. Caregiver made sure brakes were locked. 4. Client used a walker for transfer if they use one when walking. 5. Client did not pull up on walker to stand unless approved by PT. 6. Client was in correct scoot forward position, buttock at the edge of the chair. 7. Client was in correct feet back position, heels off the ground. Continuing the procedure to move a client from a chair to a bed, number 8 is that the client was in correct lean forward position. The client's nose is past their knees. Number 9, client was in correct launch position. 10. Caregiver allowed client to push from armrest prior to lifting. 11. Caregiver gave client time to initiate individual stages prior to assisting them. 12. Caregivers spoke in short, slow phrases. 13. Caregivers did not proceed to next stage until previous stage was completed and maintained. 14. Use correct method with transfer belt. And 15. Caregiver assisted client without turning walker if needed.
So, Leona, we're going to stand up and get into your bed and sit on the edge of the bed. So I want you to scoot your butt forward first, all the way to the edge. Good. Pull your feet back so your heels are off. Lean way forward. Bend at the waist. Bend more. Keep bending. Keep bending. Now push. Good. Grab onto the walker. And we have to have a turn and sit right here. Lift those knees and turn all the way around. Good. Keep turning. It's going to help with the walker a little bit. Keep turning. Now, before you sit down, reach back with your hands. There you go.
Oh, that's
So, Leona, we're going to stand up and get into your wheelchair. So I want your scoot your butt forward. Perfect. Pull your feet back a little bit more. And I want you to, not hands there, hands stay here. Lean way forward. Bend at the waist more. Keep bending. Keep bending. Now, push from here. You're fine. Push. Push. Good job. Turn and sit right here. Lift your knees. Lift your knees. Turn all the way around. Bring the walker over here. Wait, hold on. Keep turning. Good. Now reach back with your hands. And sit. Good job. We're going to briefly discuss mechanical lifts and specifically the Hoyer. A Hoyer is recommended when a client is not able to bear any weight through their legs. I strongly recommend that 2 caregivers are used when using a Hoyer. A Hoyer sling should be removed from the bed or the wheelchair following use. This is important because the client loses the pressure relief capabilities of the cushion if the sling is kept in the wheelchair. Also, if the sling is kept in the wheelchair, it can cause the client to slide. It also can cause skin breakdown in open areas. Here are just some basics when using a Hoyer lift. As always, the caregiver should move slowly and inform the client of the movements prior to them being initiated. To place the sling under the client while they're in bed, here are a few tips. The caregivers will assist the client with bending their knees and placing their feet on the bed. It is much easier to roll a client when their knees are bent and their feet are flat on the bed. The caregiver rolls the client to their side. Ask the client if they have a preference to which side they prefer to roll to. The caregiver places the half-open sling under the client's back. The sling should be pushed as far underneath the back as possible. The caregiver slowly rolls the client back onto their back and partially to the opposite side. This allows the sling to be pulled through so it's lying flat on the bed. When the sling is pulled through and there are no wrinkles, the caregiver can assist the client with rolling onto their back. To place the sling when the client is up in the wheelchair, here's a few tips. The single most important thing you can do is to have the client bend at the waist. The more the client bends forward, the easier it is to place the sling underneath them. The caregiver slides the sling down behind the client's back. Please remember to notify the client of what you're doing prior to doing it. The caregiver secures the client's knees and pulls the leg strap forward until it's tight. It's important that the caregiver support the client's knee, otherwise you'll pull the client forward in the chair. When this is done, you repeat on the other side. Please make sure that the sling is under the client's buttocks.
Before we watch the video, let's review the procedure to use a Hoyer lift to move a client from a bed. Number 1, the caregiver should move slowly. 2, inform the client of movements prior to them being initiated. 3, caregiver assists client with bending client's knees and placing their feet on the bed. 4, caregiver rolls client to the side. 5, caregiver places half-open sling under the client's back. 6, caregiver rolls client to the opposite side and pulls sling through so it is laying flat on the bed. 7, caregiver rolls client onto his back. Please watch this no sound video.
Let's talk about another mechanical lift, the Easy Stand. For a client to be able to use the Easy Stand, they must be able to sit on the edge of the bed with little to no assistance from the caregiver. If the client is unable to sit on the edge of the bed, please notify the nurse. You may need to change the type of transfer that's completed with that client. The Easy Stand is used for clients who bear weight through their legs but require more assistance than is recommended for a caregiver to lift. One of the advantages to using the Easy Stand is that it can assist with dressing and toileting. It also helps keep the older adults standing. Here are some basics when using the Easy Stand. Again, the caregiver should move slowly and inform the client of movements prior to them being initiated. Ensure all the straps are tight prior to moving the client. Encourage the client to push through their legs while the lift is being used. The more the client stands independently, the longer they'll be able to use the device. Also, notify the nurse if the client is complaining of any shoulder pain during the use of the lift. So let's discuss briefly how to get a client off the floor using two caregivers. If a client has fallen with you, encourage them to lie on their back and lay there for a few minutes prior to getting them off the floor. This helps the client relax and makes the transfer more easy. Again, the caregiver should move slowly and inform the client of the movements prior to them being initiated. It's very important that the client have shoes on and is using a transfer belt. One of the caregivers should be the lead and be responsible for communicating with the client all the stages that should occur. It's also very important that both caregivers remain calm and confident throughout the transfer. Once the client has rested, the caregivers are going to assist the client into a sitting position. Caregiver number 1 supports the client in the seated position, while caregiver number 2 assists the clients in bending up their knees. Just as with the sit-to-stand transfer, it's very important that the knees are bent as far as possible with the client. This will make the transfer from lying down to standing much easier. Once the client is seated and both knees are bent, the caregivers will move to the side of the client. The caregivers will then grab both sides of the transfer belt. Ensuring the client's knees remain bent, the caregivers will bend their knees and count to 3. Again, notice that the caregivers are standing at the sides of the client and not in front and one behind. This is a different technique. It's important that the caregivers are standing at the client's side. It is important that the caregivers are aware of their body mechanics. The most important thing they can do is to bend their knees and shift their weight onto their back foot. As they help the client stand, they straighten their knees and allow the client to bear weight through their own legs. The lifting that's being completed by the caregiver should be steady but not abrupt. Let the client stand for a few minutes prior to placing them in the chair. As you're helping the client stand, remind them to push through their legs. Once the client is safe in the chair, please notify nursing. The final section we're going to talk about is car transfers. If the client uses a walker for transfers and/or with walking, it should be used during this car transfer. The transfer techniques used earlier in this module should be used when completing the car transfer. It is much easier for the client to get in and out of the front seat of the car compared to the back. There's a lot more legroom and there's more adjustability of the front seats than there is in the back seat. The caregiver should move the front seat all the way back prior to the client getting into the car. This allows more legroom and it makes it easier for the client to transfer. Even if there is leather seats, placing a garbage bag on the front seat will help the client turn easier on the seat. When getting into the car, it is not safe for the client to grab onto the front door to pull themselves to standing. This is the same rule that applies for sit to stand. If the client uses a walker, have them follow the 4-step directions to push themselves to standing and use the walker for the transfer. It is recommended that the client sit on the edge of the seat, then swing their legs into the car. It is much more difficult for the client to step in sideways and sit onto the seat. Remember to let the client do as much as they possibly can prior to you assisting them. The caregivers may need to help the client duck their head so they do not hit it on the side of the car. Here are some tips for getting a client out of a car. Make sure the front seat is still slid all the way back to the furthest position. The client should turn around on the seat and swing their legs out of the door. Again, if the client uses a walker for transfers, it should be used during the car transfer. The caregiver may need to help the client duck their head as they get out of the car. And the same rule applies as getting into the car. It is not safe for the client to grab onto the front door to pull themselves to standing. This rule does not apply if a special attachment is attached to the inside of the door that stops it from closing. Utilizing the 4 stages of a transfer will increase the mobility of the client and decrease the work of the caregiver. The 4 stages of the transfer can be used with all diagnoses and all ages.
I want to thank you for your time and attention today. If you have any questions, please ask your supervisor or RN. When you are ready, please take the knowledge assessment.